The facet joints connect the vertebrae of the spine and are located towards the ridge of the spine on either side. These joints allow stability and flexibility of the vertebral column. When the cartilage that covers the ends of the joints wears out and degenerates, osteophytes, or bone spurs, grow in the damaged joint, leading to facet arthritis. Symptoms may come and go over a long period of time. The most common symptoms of facet arthritis include chronic pain and stiffness in the neck and lower back. If the affected joints are located in the cervical area, facet arthritis can cause severe headaches and radiating pain. In the lower back, pressure on the nerves can result in tingling and numbness in the legs. The severity of symptoms depend upon the number of facet joints affected and the involvement of the spinal nerve root. Facet arthritis usually occurs very slowly over the course of many years. And when treating facet arthritis, spinal specialists tend to use a progression of treatments, starting with prescribing pain medication, steroid injections into the joint space, physical therapy, and, as a last resort, spinal fusion surgery, where the affected joint is held in place with hardware to prevent pain and further degeneration.